Yeah. Got it. Okay.
All right, hello. I'm here to conduct a swallowing screening tool for you. So I'm going to ask you a couple of questions, and you could tell me on a scale from 0, which means no problem, to 4, which is severe problem. So then I could assess if you need any accommodations or new treatments based on your answers. Does that sound good?
Awesome. Sounds good.
Okay. So the first question I'm going to ask is, have you had any swallowing problems that has caused you to lose any weight?
No, nothing with swallowing problems. I would say it'd be a 0.
All righty. So the second question would be, has have you had any swallowing problems that has interfered with your ability to go out for meals?
No, not at all. I would say another 0.
Alrighty. When you swallow liquids, does it take extra effort to do that?
No, no problem at all.
All right. And then if you swallow solids, does that take any extra effort?
No, not yet.
All right. And if when you've been swallowing any pills, like medications, does that take any extra effort?
No, I think that would also be a 0.
Okay. Is swallowing painful for you?
No, no pain.
No pain. Okay. And does the pleasure when eating, has that been affected by your any swallowing issues?
No, I think there's still pleasure there.
Alrighty, that's good. When you swallow food, does it stick on your throat?
No, not yet.
Okay.
Good.
So do you cough when you eat any food?
No, not really.
Okay. And then the last question is swallowing stressful for you?
No, it's not really a problem yet.
All right. Thank you so much. So I got 0 points for patient 1. Okay, so then I'm going to role play for the second patient.
Okay, perfect. Okay, so hi, I'm going to be doing a swallowing screening with you. Um, I see that you have decreased appetite and some coughing. So I just wanted to go through and ask some questions if you're good with that. It'll be ranging from a 0 to a 4, with 0 being no problem and then 4 being a severe problem. Good?
Yeah, sounds good for me.
Awesome. Okay, so the first one is that, do you have any swallowing problems that have caused you to lose weight?
Yes, I have been noticing some weight loss because I've been having trouble eating. So I will say number 3 for me.
Number 3. Awesome. Let me grab a pen. Okay. Number 3. Awesome. Okay, next question. Do your swallowing problems interfere with your ability to go out for meals?
I would say so because I don't have any appetite or anything, I don't feel like going out to eat anywhere with my family. So I will say yes, 3.
All right. And then, does swallowing liquids take any extra effort?
Liquid specifically, no, I would say. Mm.
Okay. And then how about solids? Does that take any extra effort?
Mm, I would say no, not yet. No.
And then what about pills? Does swallowing pills take extra effort for you?
No.
Nice. Is swallowing ever painful?
No, it has not been painful. No.
All right. And then has the pleasure of eating been affected by your swallowing?
Yes. I haven't been eating to eat well, so I don't really feel like eating. I've lost a lot of appetite, so I would say yes, maybe 3.
Whenever you swallow, does the food stick to your throat?
It does not, no.
Okay. Do you cough when you eat?
Yes, I've been coughing a lot lately, yes. So maybe a 4.
Okay. And then is swallowing ever stressful for you?
Um, I would say a little bit like a 2 because, yeah, when I have been decreasing appetite, and that means I've been losing a lot of weight because of that. So it's been stressful.
Okay. So would you say it's a 3 or a 4?
I guess 3.
Okay, cool. So you scored a 16. And so with that number on our results, we recommend discussing your results with a physician. So
Right.
boom. Okay.
Thank you.
And
Wow.
um cool. So let's
Alright,
walk through.
so the next question will be, does your patient need to be referred to an SLP? So for case study 1, I would say like because the patient is not experiencing any symptoms yet, like they're just beginning to do radiation, I feel like perhaps we should do a follow-up, do the same type of questions again, and then whatever the answers are, then we should refer it to an SLP.
Yeah, I was gonna say the same thing, like kind of just monitoring how it goes, especially like you said, like they're just starting radiation, but it is cancer and of his esophagus, so just monitoring that.
Mhm.
Um, yeah. And then case study 2, what do you think?
I would say yes, because the score like you just did is 16, so that's a very high number. And also he has Parkinson's disease, and then like decreased appetite, lost a lot of weight, the coughing. So that's definitely like a concern because you don't want that weight to drop even lower, and he has struggles with malnutrition and all that stuff.
Yes, I completely agree. Okay. Because then also, well, I guess this goes into the next like few questions, but like
Mhm.
as far as challenges, I feel like some of those like are, like some people if you get a paper cut, like it can be the end of the world for them, and they're like, this is
Yeah.
severe, and then like some people like they're like, oh, nothing. Like I
Yeah,
feel
like
like
downplaying it.
yeah, so they might not rank it as high or as low as it could be,
Mhm.
you know. So like since it's so subjective, that could be a challenge.
Yeah.
Uh,
I was also thinking like if someone's like can't speak or communicate, you have to have either a family member or like a nurse kind of talk for them. So that could also be like a problem. Like you don't actually know like what the patient is feeling, just like what they have been observing or been told.
yeah. Oh
Mhm.
yeah, and then since we talked about it before
Mhm.
you started the video, just the challenge of the first one is that it's all like we already said we need to monitor it since everything's 0 right now, but like if they didn't think to, oh, we need to do a follow up, oh, we need to monitor them for like progression or anything like that, then they could just look at the score, the one single scorecard from the very beginning, but when radiation started, and be like, oh, they're good, and it never be
Yeah.
like on their mind again because they
Hmm.
good, and so that could like slip through the cracks too.
Yeah, like a problem to follow up with them. So that's definitely a con.
Yeah. Okay. Strengths. I think one is that I felt funny saying like the same thing with just one little change, but like they're being
Mhm.
pro with, is it liquids, is it solids, is it pills, like
Yeah,
specific since those could be differences. So I think that's a strength.
that's true. I think also the test is easy to conduct, and like a dietitian could do it and they could, go step by step. So it's an easy test to conduct.
Yeah, and it's fast.
Yeah.
And with ranked 0 through 4, um, if someone like physically can't talk, but they're still like, there
Oh,
in the head, they can like
hmm.
do fingers, like
Oh yeah, it'll be easy just to say, yeah, 0.14, yeah.
yeah. So that's nice. Okay.
Mm-hmm.
Do you feel this screener is within an RDN scope of practice? Oh, heck yeah, that was so easy.
Yes, definitely yes. Because yeah, we've been studying like diseases that has to do like with throat problems or swallowing problems, like dysphagia and stuff. So we know the MNT, the types of diets, the clear liquid, and risk for aspiration. So I would say, yeah, definitely it's on our scope.
Yeah. And I also feel like since we're always told that we'll be working with speech language pathologists like pretty
Mhm.
close. It's like all in the same area that this would just be a good thing to grow even closer in that professional relationship with
Yeah.
them, be on the same page with
Mhm.
treatment.
Yeah.
Cool. Okay. Once you are an RDN, do you feel comfortable recommending this as a part of nutrition assessment when the need is there?
I would
Yeah.
say yes. Like I said, like it's not a hard thing to do, and it could catch like many people. Because sometimes maybe if you give them a regular diet and then all the time, it would have been better as a bite size or a clear liquid or something. So if you're able to detect it earlier, then you could avoid any issues and weight loss and all that stuff.
Yeah, I agree.
Yeah.
Sweet.
I think that's it. Stop sharing. Let me stop recording.